There are 201 new COVID-19 cases in the community being reported today. Of these, 181 are in Auckland, 15 are in Waikato, 4 are in Northland, and 1 is in Taranaki, with the remaining 5 cases announced last night to be included in tomorrow's figures. There is also 1 case to report in recent returnees in our managed isolation facilities. Further details are in the 1 p.m. statement. We are very aware of the grief and hurt whānau who have recently lost loved ones to COVID-19 are experiencing. This is a serious virus, and none of us can afford to underestimate it. If you or your loved ones are being cared for in the community and you feel that your or their condition is deteriorating, please don't leave it to chance that you'll improve. Please reach out as soon as possible or ask someone to do so on your behalf. This is the advice that's given to anyone and everyone who is being cared for in the community with COVID. Hospital care is free and ambulance services are free for those with COVID-19. Our hospitals are ready to help and have robust infection prevention and control measures in place to keep you and your loved ones safe. I'd just like to acknowledge that people have died this week, and that is tragic for their friends and family. This is a very real reminder that the more people who get COVID-19, sadly, the more deaths we are likely to see. It is a sad reminder that COVID is potentially fatal, and this is particularly true if you're unvaccinated. Just moving to hospitalisations, there are 85 people in hospital with COVID-19, including 3 who are still being assessed. Of these, 11 are in ICU or high dependency units. The health system in Auckland can cope with these and the forecasted numbers of cases and hospitalisations. And I'd like to reiterate that there are more than 1,700 hospital beds across Auckland and more than 100 ICU beds. Currently, overall hospital occupancy is about 86%, ICU occupancy is around 70%, and ventilator occupancy is around 15%. It should be noted that the ICU bed capacity does change daily, depending on need and staffing. We can manage, but it is important that we limit the load on our hospitals. And there are 2 key actions that all New Zealanders can do to ensure that our health system is able to provide for everybody's health needs. And those 2 things are get vaccinated and continue to abide by the alert level restrictions. It's also important that anyone who needs care for any reason seeks it. Do not delay. Specifically on Auckland, just an update there, public health staff are continuing to urge anyone with symptoms, no matter how mild, to get a test. The focus is currently on those living in Ranui, Sunnyvale, Kelston, Birkdale, Manirewa and Mangere. People living in those suburbs need to be vigilant and get tested if they're symptomatic. There are 18 community testing centres available for testing across Auckland today. Testing centres at Northcote, Balmoral, Otara and Wiri continue to operate extended hours to increase access to testing in those areas. Public health staff are supporting almost 3,000 people to isolate at home. That's made up of 1,382 cases across 929 households. Just an update on Auckland Rest Home in Avondale. A second round of testing was carried out on residents and staff yesterday after 2 residents tested positive for COVID-19. 1 further resident tested positive yesterday and has been admitted to Auckland City Hospital. Other results from the second test of all other residents and staff received so far are all negative. Turning to the cases in Stratford now. 1 of the 6 are in Taranaki Base Hospital and is in a stable condition. The 5 remaining cases are isolating at home. All of these cases are clearly linked and are also linked to the Auckland outbreak. Contact tracing is underway today to determine the movements of the cases and any locations of interest. 5 locations of interest, including pharmacies, a hardware shop and a supermarket, have been added to the Ministry's website so far. So far there have been 5 close contacts identified, and our investigations still continue to see if there are any additional ones. Just to note that these cases are highly likely to explain the recent wastewater detections in the town, and the most recent detect there was reported on Tuesday. And we want to remind anyone in Stratford or any recent visitors to the town with COVID-19 related symptoms, no matter how mild, should get tested. Details of the testing and vaccination centres throughout Taranaki are on the Taranaki District Health Board website. And just on vaccination, as of yesterday, 86% of eligible people in Taranaki had received at least 1 dose of the vaccine, 73% had received a second dose. For Māori in Taranaki, 73% had at least 1 dose, 54% have received their second dose. Yesterday, 801 vaccines were administered in the region. This is a really good time to get vaccinated if you haven't yet done so. On Waikato, there were 15 new cases confirmed in the Waikato overnight. 4 cases have been linked to previous cases so far. The remainder of the cases notified investigations are underway. Locations of interest again are on the Ministry of Health website, and yesterday they were identified in Hamilton and Otorohanga. There are 7 pop-up and dedicated testing sites across the Waikato today: Hamilton, Ngāriawahia, Huntly, Otorohanga, Te Awamutu and Te Kuiti. Yesterday in Waikato there were 3,377 tests processed and 2,628 doses of vaccine given. In addition, COVID was detected in a wastewater sample collected from Taupo on the 8th of November. A repeat sample was taken on the 10th of November, and we expect those results later today. And as we've seen in Stratford, this can be an indication of a case in the community. It can also be due to recovered cases who may be there, but we encourage anyone in Taupo with symptoms, even if they are mild, and regardless of vaccination status, to get tested. On Northland, there are 4 new cases in Northland being reported today. That brings the total to 39. 3 of those new cases are known close contacts of existing cases. That leaves 1 who is still being investigated and interviewed. Just a note that a person who was previously under investigation yesterday after returning an initial positive result has been reclassified as not a case after being confirmed with repeat negative results. In Northland, there continues to be a good turnout for testing, 985 swabs taken yesterday. There were also 1,276 people vaccinated in Northland yesterday. And details of testing and vaccination centres can be found on the Northland DHB website. And just finally, we are hearing reports that health professionals are being put under considerable pressure to provide vaccine exemptions when the process is just getting underway. Just want to reiterate that there is a single national process with strict criteria, and this is the only process that can be used. So please be patient and be kind to frontline staff. The application process and the criteria under which you can apply is on the Ministry of Health website. The next step of our process is just to confirm the panel members, which we will expect to do in the next couple of days.
You will have seen yesterday that we hit 90% of eligible New Zealanders having had their first dose of the vaccine and 80% fully vaccinated. This is an incredible milestone, and I want to thank the millions of New Zealanders who have taken up the opportunity to get vaccinated. On a DHB basis, 6 of our DHBs have now hit the 90% mark for first doses: Auckland, Waitemata, Counties Manukau, Capital Coast, Canterbury and Southern. Some others are very close to hitting that milestone. South Canterbury is 842 doses away. Hutt Valley is just 542 doses away. This weekend, people in those areas could go and get vaccinated and push their DHB past that 90% milestone. And indeed, right across New Zealand, this weekend is a great time for people to get vaccinated and protect themselves, their family and their community. On the topic of vaccinations, the requirement to be vaccinated for our health and education workforces starts next week. I want to thank the vast bulk of health and education workers who have already been vaccinated. Cabinet has only chosen to require vaccination of workers in the highest risk settings, and this is not a decision that we took lightly. Under 12-year-olds can't be vaccinated yet, but they can get COVID. In fact, about 20% of the cases in the Delta outbreak have been children aged under 12, including babies. So this is one of the reasons we're asking health and education workers to be vaccinated, to protect those who can't yet protect themselves. We've also seen that when COVID gets into school and education environments around the world, that it can spread quickly and easily. For health workers, it's a similar equation. People entering our hospitals, GP clinics and other healthcare settings often have compromised health already. As we've seen in this outbreak, our hospitals and healthcare settings have become some of the key places that COVID is seeding and spreading. Having health workers vaccinated means that those who are sick can have that extra layer of protection from the virus. So getting vaccinated is not only about protecting yourself, it is also about looking out for those around you and those you come into contact with, especially our children and the sick. Vaccine requirements have been commonly used overseas. They work, and they're a key part of the vaccination drive in those countries with high rates of vaccination that we're trying to match. Just a quick word on vaccine certificates. As you all know, vaccine certificates are in our very near future. And so far, 700,000 New Zealanders have signed up to My COVID Record to create an account. This is where that vaccine certificate will land shortly. So if you haven't already signed up, I encourage you to get cracking today at mycovidrecord.health.nz. And finally, just before we finish up, I'd like to remind everyone that the new Resurgent Support Payment is open for applications. This is now a double payment calculated weekly but paid fortnightly, the payment being at a rate of $3,000 and $800 per FTE up to a maximum of $43,000 per business. The wage subsidy also continues to be available to eligible businesses on a fortnightly basis as well. Since the current outbreak began, we have paid out $5.5 billion in economic support via the wage subsidy scheme and the Resurgent Support Payment, which has helped to keep New Zealanders in work.